question and answers don't hurt my brain, but you guys challenge me. These are hard. Let's do some Q&A today. I'm glad I'm the only person you trust. I appreciate that. Now, just communicate that to my wife so that she knows people actually trust me. It's not going to go bad in the same way that, like, you know, food in the fridge goes bad. It's probably not going to grow mold on it. It might, but that's not what happens. You're right. It does lose some of its efficacy. It's a drug. So drugs have a half-life, which means they degrade over time. So I mean, should you throw it away? You could try using it. It might still have some potency, but you're not going to get the most efficacy if it's expired, especially if you've already opened it. Now, if it's an unopened bottle, I could, you know, make the argument that you should just keep it and use it, but probably should toss it. But use it. Save your money. You know what? Use it unless it gives you a problem. But don't take this as medical advice. And then come see me after. What should you use around your eyes? So tretinoin, technically, if you want to use the technical thing, you can use it around your eyes, but most people find it a bit too harsh because this skin is very thin and there's no layer of subcutaneous tissue, meaning that tissue underneath the skin. So it can be harsh. So what I would say is find a product, if you want to use an eye cream, which you know my stance on eye creams, but find a product that is good with antioxidants. Make sure you're wearing your SPF, and you can use a retinol or a retinal, something that's a bit more gentle and still turns your skin over. Now, there's some amazing eye creams on the market now that combine almost everything. They blur the dark circles under your eyes. They have a little bit of pigment in them to mask some of that pigment that you have on there. They have retinols in them, and they have sunscreen. So there's some great products on the market. You really just have to make sure that the product that you're buying is not a money grab from the brand, which is a moisturizer put in a small jar and an upcharge. You got into an accident, I'm sorry, and you broke your nose. What's the answer for this? Well, it's complicated. It's probably not what you want to hear, but when you break your nose, you don't just break the bone or the cartilage or even just traumatize the skin. You could be damaging everything on your nose, which compromises your breathing, the way your nose looks, and can even give you what we call a saddle nose, or where your nose almost collapses in if that cartilage is not getting a blood supply. So no matter what, if you get any kind of trauma to your face or head, you really should be seen by an expert in the emergency room or in follow-up after. So if you're healed and everything's done, all the bad stuff is out of the way, you might be a candidate for a septorhinoplasty. And it could be something that's a functional surgery where we're just focused on your breathing, or it could be focused on both the breathing and the aesthetic part. The key part of this whole thing is going to an expert with your concerns and with your ask, and then getting their opinion. Ultimately, your choice. It's your complete choice what you do with your body and your face, but you have to have recommendations from an expert. We should have a competition between TikTok and Instagram because all these questions are from TikTok. So if you're one of my Instagram peeps, drop your questions below. I'll get on them to answer them. And if you want to see me in person, you know where to find me.